Hi, Dr. Wright again from Walnut Creek Animal Hospital in Purcell, Oklahoma. And we're continuing our series on canine first aid for the working class dog. We have a dog today that's been presented that has a small laceration, so we just want to go over wound care on how to clean this thing up properly before we get it bandaged. And this applies to any area of the dog, regardless of where the injury is. So we're going to take a real close look here. Basically what we have available, three things. We want a pair of clippers, we want some scrub. If you don't have water and scrub, we can use something like sterile KY or some type of water soluble material. But ultimately what we're first going to do is shave this area if we can, try to get most of the hair off of it so that we can completely evaluate what's going on. Now we can more fully see the skin deficit at this point once all the hair is removed. So hair can usually maintains quite a bit of an obstructive pattern to the view of what's going on. And so this is, like I said, a full thickness laceration, and there might be grass or anything stuck in there. So two different ways of doing this in the field. One would be to apply sterile KY into this and really work it around well. And what it does is it helps to attach to hairs and grass and that sort of thing, just to get this thing kind of grossly cleaned out a little bit before we can bandage it. The other method would be using some type of surgical scrub, and if this is a really large wound, we're really going to open this thing up, and clean this up really well. Make sure all of the grass and the hair is removed, and you're actually going to make it bleed just a bit, whenever you do this sort of thing, because you're going to knock blood clots loose in those small vessels and everything that are in that area. And so then we're just going to take saline and we're going to flush that really well. So you can see the amount of debris that we're still getting off of that wound. Once the thing is completely cleaned, now we're ready to put some type of topical antibiotic ointment on there and then apply a bandage. So topical, then bandage, and follow the bandaging procedures. Thank you.